Depression is the most common mental health problem that affects patients with serious illness. It is often unrecognized, and even when recognized, it's often undertreated. And this poses a problem in the seriously ill patient because depression is an independent predictor of not only increased suffering in the patient, but also of mortality. We focus so much of our efforts sometimes on the main diagnosis, whether that be cancer or COPD or CHF, that we sometimes don't look under the surface a little bit to see the other things that may be affecting a patient. Screening for depression in the seriously ill patient becomes important because making the diagnosis of depression is different in a patient with comorbid illness versus someone who's just in a primary care setting. Physical symptoms such as fatigue and insomnia are part of serious illness. So how do we differentiate that from depression? So what we do is in palliative care, we use screening tools to try to identify patients that are having feelings of hopelessness, worthlessness, and even suicidal ideation, because these are much better indicators of someone who is depressed while at the same time suffering from another serious illness. Once the diagnosis of depression is made in the seriously ill patient, treatment should start immediately. The choice of agent of treatment is not as important as starting treatment immediately and counseling the patient on what to expect. The drugs to treat depression are effective and well tolerated, and while some may take several weeks to work, the majority of patients begin to feel better soon after taking these medications and get on the path to a higher quality of life.